Oh, we should be good now.
Hi, good afternoon. Thanks everyone for joining the meeting. Sorry we're a few minutes behind. I'm glad that many of you are using the FAQ email address. We have been able to review that to help inform this agenda. And we're hoping that as this meeting continues, that we will be able to utilize this meeting as a means of communicating across all providers and to the extent practicable, minimize some of the one-off regional meetings unless there are specific questions or urgent questions that only affect that particular group. So with that, we will kick off this agenda. I hope that everyone received a copy of it. If not, I'll just really, is it available in the, as an attachment? Okay, so I'll just really quickly run through what we're going to cover. Today, we're going to talk about the fee-for-service and direct billing, the Idrd waiver renewal, the 6.2% FMF funds, the Therap billing update, COVID-19 and emergency preparedness. We're going to do a policy update related to voter registration and voting rights, as well as other Ddsn directives that have moved through the policy subcommittee and the commission. We're also going to provide a case management update and highlight some upcoming events. And then we'll open it up to specific questions and try to adjourn right at 3 to be mindful of everyone's schedules. With that, I will move us to Roman 2, fee for service and direct billing.
Sure. So I just wanted to provide a quick update to where we are with fee for service and direct billing. We are still moving towards a March 1st implementation date. You guys all received an updated contract from Ddsn that'll be effective on March 1st. We got the majority of those contracts back and they've been executed. I think there were just a couple we were trying to run down. And for those of you that haven't, if you could get those in, that is a requirement that you need to upload that contract or fax it in with your application for provider enrollment. Provider enrollment is open and active, and providers need to enroll as quickly as possible. HHS is working on doing some billing testing with a couple of providers that they're kind of pushing through that enrollment process. Once that testing has been completed, HHS will schedule some billing training for providers, and then we will try to piggyback on that billing training with the Therap billing training for those of you who choose to use it. So we've got a couple of questions about that. When will we get our new provider number? We applied, faxed our contract, no word on the provider number yet. So I think HHS, and I believe Margaret is online. So Margaret, if you want to speak to it, you can, but I think HHS mentioned in the beginning that it can take 3 to 4 weeks to complete that provider enrollment process. And you will get your Medicaid number once provider enrollment is complete.
Hey, Lori, this is Margaret. Can you hear me?
Yes.
Okay, great. Yes, you're correct. Once the provider enrollment process has been completed, then the provider ID will be provided. So I will do a check-in and update on the sequence of those that have been received and the status, and be glad to provide an update on that shortly.
Sure. And just so you guys know, one of the things that we did jointly with HHS is HHS has a list of providers that have executed contract with Ddsn as kind of a list of people that they're checking against. So we'll do some reconciliation if there's a problem, you know, as we get down the road a little bit. If something's wrong or if they don't have something, we will let you know. Let's see, I got several questions, so I'm going to try to get to them one at a time. Ralph, I think we answered your question about when you will know if it's successful. There's a question about where a copy of the training that was provided for provider enrollment can be found. That's located on the microsite that HHS has set up. We included a link for that microsite on the bottom of this agenda that should have been emailed to everybody. So if you don't have a copy of that agenda, we can forward it to you, and you can have a link to the microsite where you can find a recorded copy of that training. There's a question about the contract. Margaret, that contract gets sent in with the fax cover sheet. Is that correct?
That is correct.
So, Beth, if you don't have that fax cover sheet, if you'll shoot me an email, I can send it to you. Margaret was nice enough to send it to us so we could make sure that y'all had it. There's a question that says, if NPI is for ICF, can it still be used for enrollment, or will we need to apply for a new NPI? Margaret, do you want to go with that question? It's about enrollment and NPI number. You're muted if you're talking.
Sorry, I was trying to find the question in the chat.
Yeah, so it says, if an NPI is for an ICF IID, I think the question is, if the agency has an NPI number, do they have to get a new one?
They should be able to use their existing NPI. They would just need to update the taxonomy code. So I see that there are a lot of questions about taxonomy codes. Within the training, some common examples were provided that would apply to different provider groups. And we would recommend that based on those examples and what is available through the NPI website, that you choose the one that is most appropriate to the services that your organization provides.
So I think there's some questions about the fax cover sheet. So when we finish the meeting, I will reply to everybody that was invited to the meeting and include the fax cover sheet. So that way anybody who was invited to this meeting will get it. Any other questions specific to the fee-for-service or direct billing?
Lori, this is Susan. Can you hear me?
I can.
Yeah, just a real quick question for Margaret.
Oh, you went away, Susan. Can you start over?
Yeah, can you hear me now?
Yes.
Okay, I said, Margaret, if we choose a taxonomy code to enter in our application, but then bill under a different taxonomy code that wasn't in our application, will we be paid still if we didn't choose the right taxonomy code?
It's my understanding that the taxonomy code is not directly linked to the billing process. So you should be fine in terms of claims and billing. Do the best match that is appropriate to the services you provide. But there should not be an impact from the taxonomy code on the billing process.
Thank you.
I will also check to make sure that the fax cover sheet has been uploaded to the microsite. I'm not seeing that it is there currently, but I will follow up on that and make sure it gets listed on the microsite as well.
So Margaret, I think there's a question about if a provider sent in their contract without the fax cover sheet. When they get the fax cover sheet, should they send it again with the cover sheet attached? Or are we good if they send it to the right fax number, but just without the cover sheet?
So I believe it is important that the reference ID was sent in, whether that was written in on the contract, but that there's a place on the fax cover sheet for that reference ID. So if you did not include that, it wouldn't hurt to fax it in again. And again, we're pulling a current status, and we'll give some feedback if there are any instances that there's missing information that we need to reach out for.
Okay. Next item on the agenda is the Idrd waiver renewal. We are currently in an RAI status, a request for additional information status with CMS. There are just about 4 points that HHS is really trying to answer, but we feel certain that the renewal is going to get approved and be retroactive back to January 1st. You guys are aware of the changes made in the renewal around residential tiers and that kind of thing. But the other changes in the renewal will also be moving forward, the addition of new services, some changes to services, that kind of thing. So just kind of stay tuned for the rollout related to that renewal. One of the other big things that will impact you as providers related to that renewal is some significant changes to the performance measures, which is kind of new and exciting ways that Ddsn will be doing some oversight activities. So I encourage you to kind of read that and get familiar with it. So any questions about the waiver renewal specifically? Okay, the next item on the agenda is the 6.2% FMF funds.
Okay. All the funds have been dispersed for the $4 million for the day service providers for reopening services to at-home individuals. If any of you have not received your funding, please let me know, because this went to the CG's office a week ago Friday. You should have all received a memo explaining how it was determined, the number of units and the calculation that it was based on, and the dollar amount. With regards to the $5 million for FMAP that addresses the labor shortage through funding for targeted staff retention and recruiting in the form of enhanced rates, bonus pay, incentive pay, and hiring bonus. There are currently 9 agencies that have sent in both of their plans, and funding is being distributed. It's about 10.6% of the total funds will be going out tomorrow. And just as a reminder on this, there needs to be 2 plans. There needs to be one in which your plan, what your intentions are for the use of the funds, and the second for the proposed plan for providing evidence that the funds were in fact expended as proposed. A good example of that is if you're offering a bonus, payroll register is what I'm pretty much getting back in return as proof that you spent the funding. Also a reminder, I'm getting a number of attestations. The attestation is only required back to us for those agencies less than $1,000. Anything more than $1,000, we just need the 2 plans. And we're still waiting on just 13 attestations for those receiving less than 1,000. But we are waiting on the majority, 91 still, for those that I haven't received plans for. And the plan is the money will be distributed once your plan is approved, probably give me 48 hours to get it to accounts payable, and then it will take another couple of days to get it to the CG's office and a couple of days to get it to them versus it should be a electronic transfer into their bank. Any questions?
Yes, we have one question, and the question is there a time frame that the money needs to be spent by?
No, not that, nothing that I know of. Just don't take years for me.
Right.
Yeah.
Other questions about the disbursement of the 6.2% FMAP funding? Is there a particular template for the plan, or are you just looking for them to?
No, I've gotten, as a general rule, what I'm getting is on the agency's letterhead, the plan detailed out as to what they're gonna spend the funds on. And then underneath that, how they're going to show Ddsn they spent the funds, but there is not a set template for it, no.
So there's a question, are the bonuses that have already been paid applicable?
We are going to provide some updated guidance related to this. We've been getting a number of questions, so stay tuned. We will send additional guidance, not only to this question, but regarding the parameters of creativity under the existing language that was approved by the commission. So we'll get that out yet this week.
So Jason says, back to the Idrd waiver renewal, where can I easily access these documents? I think we can send that out, you know, based on how it was submitted. There have likely been some tweaks since the posting of the document, based on the RAI, but I think you can, I'll send you a link, Jason, to kind of where the last posting was.
And Lori, you're correct. There have been updates as we have gone through the approval process with CMS. We've been in close contact and having weekly calls to address any remaining questions. So from the originally submitted document to the final document, there will be changes reflected. Just wanted to echo that.
Sure. All right, the next item on the agenda is a Therap billing update. We are meeting with Therap multiple times a week to try to ensure that we have a billing option available for you guys through the Therap platform. So we feel pretty confident that there's going to be a module available through Therap's attendance module for all waiver services on March 1st. I say it that way because it really means kind of some differences in the way that maybe you're used to invoicing happening. Everything will kind of flow through their attendance module, at least at first. We talked with Therap today about trying to put together something for you guys to see the kind of what it looks like. Because I think you don't have a frame of reference, and that I'm sure makes everybody nervous. The actual training on what you will be using in your system is not going to be ready until right before go live. But we do want to try to give you something that will at least ease your mind a little bit about what it looks like. You can also go on Therap's website. They have some user guides, trainings for some of their off-the-shelf billing stuff that we're not using it the way that it is off the shelf, but it'll at least give you an idea of what their attendance looks like, you know, what their billing looks like, what a claim looks like, that kind of thing. The other thing is for case management specifically, that's probably the service that it looks most differently than what you're used to. We are looking at some options to try to help with some of that workload. And we don't have those all worked out yet, but we just want you to know that we're looking at it and thinking about it. Any questions about the Therap billing module? All right, the next item on the agenda is the COVID-19 emergency preparedness. That's you, Rufus.
All right, thank you, Lori. As you all know and have experienced, many of you have experienced surges in positivity rates for COVID-19. We're starting to see a decline in the positivity rates, at least over the last few days, which is a welcome blessing. But we recognize the economic impact on your operations from having to close some of your facility-based day programs to also alter in a way that you engage stakeholders. And so one of the things that we're working in concert with the Department of Health and Environmental Control, we hope to host a third installment of an infection control webinar to not only relay and convey strategies to mitigate the spread of COVID-19, but also other infections. The tentative date for that webinar is January 31st. We're waiting final details from DHEC, who will also share the link and virtual meeting format for that webinar. So again, just pencil on your calendars, January 31st, an infection control webinar in concert with the Department of Health and Environmental Control. On the 13th, we published Situational Report number 53. That report has a lot of detail regarding resources that are available to help you maintain testing protocols, as well as information regarding vaccination or where to receive vaccines. If for some reason you don't have any operational constraints relative to obtaining personal protective equipment and or vaccines or testing, you can email a request for assistance to eoc@ddsn.sc.gov. I know a couple of weeks ago, a provider had a rash of positive cases of COVID, and we're running low, or their burn rate for N95 masks were low, and we were able to utilize some of the emergency supplies that we have to assist that provider out. And again, we want to do that when and where we can, but it's incumbent for everyone to continuously, procure PPE. But if there's ever a situation where you get low or you're in dire straits, contact the agency through eoc@ddsn.sc.gov, and we'll do our best to help you or put you in contact with the Healthcare Coalition or members at DHEC to help resolve your issues. From an emergency preparedness standpoint, it's that time of year to where emergency preparedness plans, especially relocation agreements for those that have contingency plans and 24/7 operations that require, relocating, regarding a localized disaster or a disaster that has the potential for catastrophic impact. And so those agreements are really vital to not only have in place, but also to plan and prepare to look at sites, because as you add new individuals in your care, you want to make sure that not only the individuals that provide care, but also those you serve are aware of the steps and actions necessary for kind of an all hazards approach to emergency preparedness plan. And so revised emergency preparedness plans, specifically relocation agreements, should be submitted to Ddsn by the end of March. And so now's the time to start looking at those plans and agreements to make sure that they're viable. And so again, we recognize the toll that not only the public health emergency, but as of the last couple of weeks, some of you had to initiate other emergency plans and response efforts tied to winter storms. And so again, I think the network collectively has responded appropriately and been able to maintain adequate care and supervision and engagement. So kudos to all staff, not just frontline staff, for what you guys are doing on a daily basis. It requires a lot of fluidity and as well as compassion, and a lot of folks are working a lot of hours. So we do recognize that and commend you guys for what you're doing. That's all I had.
There's one question for you, Rufus, and it's, is there any guidance that Ddsn is going to provide for providers who operate ICFs as it relates to the CMS vaccine mandate?
Yes, and I'm glad they brought that up. Yeah, our general counsel is taking the lead and working with other general counsels at state agencies and at the state level we want to make sure that, we're vetting through the appropriate outlets per executive order, but also to make sure that we're doing our due diligence. We haven't amended any conditions of payments for operators of intermediate care facilities, but post our engagement with Health and Human Services, the governor's office, we will issue some guidance as well as likely hold a targeted meeting of operators of intermediate care facilities within our network to make sure that we're all on one accord and to make sure that they're uniform tenets and processes with respect to some of the bona fide mandates of the final rule, which one of those being a pathway for reasonable accommodations and exceptions. We don't want there to be a lot of variability in that process, and so we're going to take the lead to issue some guidance to help providers and operators of ICFs.
There was one question related to Therap billing. Jason asked if we were interested in provider work group to help with brainstorming the billing. So Jason, absolutely. I think the issue, at least the initial push for the Therap billing, is such a tight time frame that we're going to basically have to work with what Therap can give us. I'm likely going to reach out to a couple of case management providers to discuss maybe some things that we could do to help in that arena, because like I said, that's the one part of their billing that is going to be really different from anything you guys have done before. But like I said, I think the long-term goal with Therap, hopefully by July 1, is going to be to give us kind of some more some billing that is a little bit more useful to providers. And so as we move from that initial implementation to the July 1, which is kind of what we really want, we will definitely engage providers with helping to make sure we do that. Like I said, this tight time frame is becoming like what can be done versus, sitting and talking about what we want. There's another question for you, Rufus. If we're working on our policy for ICF, should we hold off in implementation?
No, you should continue to, in good faith, conceptualize and draft policies and protocols locally, specifically as it relates to, actions for personnel. I know that so that question came from Heather. So they should continue to conceptualize, policies and procedures to comply with the omnibus COVID-19 healthcare vaccine mandate.
You want to do the next question?
No, it's specific to 21 supplier types. So Brennan, Ram, and so for our system and for our operators, although we have relationships with other entities that deliver services that are out of the quote unquote Ddsn network, this applies specifically to ICFs and 20 other supplier types that are, that have varying functions, hospice settings, community mental health centers, home health agencies. And so it's not specific or germane to our network other than ICFs, with the exception of our relationships with the providers that serve children.
All right, the next item on the agenda is around some recently approved Ddsn directives. I just wanted to remind you guys that the policy committee reviews directives pretty regularly, and you see those directives or hear those directives getting approved in the commission meeting. So I just want to call your attention that as those get approved, you may want to review them, familiarize yourself with them a little more. There was recently a pretty major change made to the directive that used to be entitled Motor Voter. It was the same directive number, but it was retitled to Voter Registration and Voting Rights, and it includes information about voter registration as well as acceptable ways to assist people with getting to the polls and voting. So just wanted to call your attention to that. The other thing is, as we move into direct billing and our new relationship, with providers, those directives will likely start changing at at a more quick pace, and there might be, we're gonna have to look at them in a new light. So I just wanted to kind of let you know that there should be a good bit of policy work that'll be done in over the next few months as we move into this new world. If you have any comments related to those directives, remember you can always comment on them anytime you want. Plus, there'll be a comment period prior to their implementation. So just wanted to kind of put that out there. The next thing on the agenda is around case management updates. I just wanted to really make sure that you guys are thinking about the impact that all of this, the waiver renewal, direct billing, everything has on case management. The issuing and the receipt and the acknowledgement of authorizations, particularly in the Therap billing module, is going to be huge. So case managers really need to be engaged with everything that you're doing residentially, everything that you're doing from a day perspective. We're kind of revamping the ADT process. Case managers will be, we'll have to make sure case managers are aware of everything going on related to transfers and that kind of thing. So I just wanted you to know that you need to make sure that you're keeping an eye on your case management departments. And if you are providing direct service and you have case management with outside providers, you need to make sure that you cultivate those relationships and that those people really know kind of what is happening. There is a case management work group. It was rescheduled for this Wednesday. It was supposed to be last Wednesday. So I extend an invitation to anybody that wants to come. We talk about other stuff too, but we're kind of entrenched in the things that need to be done around this transition to direct billing and fee for service. So in reference to direct billing for CTH1 clients, where can we find information related to required documentation? So the residential standards have information about the required documentation to support the delivery of residential habilitation. And that is where, you would need to make sure you have that documentation present before you mark them present for the day in order to bill for the service. As we work towards the Therap billing module enhancements for July, it will tie attendance to documentation. So that will be, that will really help providers make sure that they have that stuff in place. But when we move on March 1st, it's essentially going to work the way it had in ResLog, where you have that documentation somewhere, but it might be in a paper file or something, and you're marking them present or absent in the Therap module. All right, the next item on the agenda is upcoming events. I think that's you, Tommy.
The biggest event we've got coming up is Disability Advocacy Day on March the 2nd. Registration starts at 9:30 and it's on the north steps of the State House, which is the back of the State House, which is Gervais Street. And again, that's coming up on March the 2nd, 2022. Rufus, did you say you had another one to add?
Email, just real briefly. On Wednesday, we're having the Ddsn new hire provider network onboarding / orientation. Several agencies, individuals have already registered, so that event is already closed. But we hope to have that event available on a quarterly basis. So as you hire new staff and feel that it would be beneficial for them and or for those that have boards of directors that may want to come and learn about Ddsn, kind of get a Ddsn one-on-one and learn about some of the services and actually hear from some of the program managers that operate those services, so you can put faces with names and have a real good opportunity to learn more in depth about the different service lines, as well as meet those program managers who are responsible for those service lines and the subject matter experts here at Ddsn. So that event is Wednesday from 9 a.m. to 3. I mentioned the Ddsn infection control webinar. We'll push out information regarding the exact time, virtual meeting format. We're working with the South Carolina Treasurer's Office to record a webinar regarding the Palmetto Able accounts. And once we do that, we'll send something out and have that video or that webinar accessible via our website. And also Dr. Fry wants the agency to establish kind of an e-learning library. And so we'll have some other content that we pre-record or meetings that we record and add to that e-learning library and push that out to the provider network. So as you hire new staff or need a refresher on a particular topic, or have a training topic that you want us to address, we'll be able to have that kind of as a working library of on-demand training content. And then lastly, this month, we were hoping to have community inclusion fairs at our regional centers, and that's an invitation to invite those of you that provide community-based services to come to our regional centers so that the folks that we serve and or their families and our staff can learn directly from you all as subject matter experts to talk about the service lines that you offer, in hopes that we can educate and also encourage those in our care who live at our regional centers to pursue living more inclusive settings, even if it includes returning to live home with natural supports and the availability of some of the newly established services in our home and community-based waivers, but also opportunities that exist within those of you that operate community residential programs. So with the surge in COVID, we kind of postponed this initiative, but we hope to kick it off in February. And so again, we hope to have a number of you to participate and join us in helping educate those that live in our state-operated regional centers or ICFs, learn about community services and resources.
So at this point, I think we can open it up to additional questions or remarks that you guys might have. I see there's a question about the bid, the fixed price bid for early intervention. That's not yet released by procurement, but we'll keep you guys updated and let you guys know as soon as it's out there. Somebody asked if there's, even though the increased 10% FMAP is not on the Ddsn agenda, does DHHS have any updates?
Hey, this is Margaret. So we are in contact with CMS. We are still awaiting our final approval of all activities as submitted in the initial spending plan. We did provide all additional information that was requested on that plan. The timing will be, we will have additional information to share in terms of timing of that increased FMAP. Much of that is dependent on receiving that full approval from CMS, as well as some technical aspects of how the funding flows through. But we are continuing to work on the proposed activities within the initial spending plan. We have provided a quarterly update and will continue to do so. But that is the update as of today.
There's a question about the employment services contract. So you should have gotten a new employment services contract recently that you signed that goes into direct billing. And that is, that will be your new contract for employment services. There won't be a fixed price bid related to that. There will be, so for new providers, Ddsn is developing a qualification process that people will complete prior to enrolling with Medicaid, and then there will be that oversight of the service in various quality measures throughout the time that you're an approved provider. So there's a question about when EVV is going to start. I think the last date that I saw, you're gonna have to help me, Debbie. I think the last date that I saw was April or May. It keeps getting pushed out for various reasons. So,
I think the go live date and the last one I saw might have been May 7th.
yeah, that's what I saw. So the last date we've seen, Chris, is May 7th. You know, and we'll do there will be a training rollout ahead of that. And the initial date was supposed to be like March, and there's just been several snags. Any other questions? So Laura, EVV services are what are considered in-home care. So it's personal care, respite, nursing, in-home supports, companion, attendant care, those services. Will HHS be providing cost report training for providers, since I assume we have to complete the same form that Ddsn does now? That's for you, Margaret.
So I would anticipate, yes, as we're putting the training package together, that we will include any and all reporting requirements and documentation requirements. So great question. I do anticipate that we will be providing additional information on that.
When reviewing authorizations in Therap, I am not seeing separate day authorizations for residential clients. Has case management been provided training on this change? So there were always separate authorizations for day services regardless of where people lived. So that wouldn't be a change. So Elizabeth, if you're not seeing those day service authorizations, you need to talk with your case managers. If there's questions, they can reach out to Janice Moore or Jennifer Jakes, but the plans in Therap automatically kind of alert the case manager to do an authorization for people for those services. Chris says, during this interim period where we are quasi fee for service, should we still be paying third-party day providers that provide services to our residential consumers? So yes, Chris, what will happen is, I didn't say this during the fee for service update, but during this kind of transition period, we have invoices set up so that when billing closes in February for January, we will run the invoices for your residential and your day. We will add them together. If they are more than the band payment that we paid you, we will pay you the difference, right? So that includes like third-party day, right? Yeah. So if you have paid a third-party day person, then we will add that together to look at your band payment. I do too. We appreciate you guys coming today, and we look forward to seeing you next month. Remember to continue to use the inbox. What's it called? The email where they send it. Oh, here we go. Forum, agenda, and frequently asked questions at ddsn.sc.gov.
Correct.
All right, thank you all.